Hello. The topic of our today's lecture is general inspection of the patient and its importance in the diagnostic process. I pay attention that it is more significant examination which are used for diagnostics because visible signs of disease help the doctor formulate primary opinion, clear its and control treatment and health and process. Inspection must be made with definite special rules. No, more comfortable and more optimal if the patient will be examined in daily time. If it's impossible, will obligatory repeat inspection, especially some parts of the body in daily time. Body should be inspected by successfully encountering the patient and examining him in direct and side light. And I'll pay your attention. We'll examine patient continually. First of all, whole body, then we'll go along separate part of the body, and I'll pay your attention. We'll go from up to down, from front to the back. We'll start our examination from assessment general condition of the patient, because depending on general condition will be dependent time of next doctor manipulation and time of treatment. General condition of the patient depends from the functional activity of vital organs: brain, central nervous system, lung, heart, liver, and kidney. And if you remember and understand these principles, you will easy answer on this question on exam. General condition of the patient depends from the functional activity of vital organs. We distinguish three main types of general conditions: satisfactory function of vital organs hold, and patient can be examined anytime and completely, because his condition is satisfactory, no any aggravated factors. Middle heaviness condition is characterized with affection of vital organs and disturb their function, but they disturb vital activity but cannot provoke immediate death of patient. Middle heaviness. For example, patient with high fever, with high blood pressure, with some other problems which indicate about dysfunction of some vital organs. And grave condition is characteristic for the patient with insufficiency of vital organs. Other words, maybe all or more than two vital organs affected and their function significantly disturbed, such that we cannot give any prognosis for the patient's life. His life can be stopped any time. And you understand, depending on general condition, will determine next way of his treatment and examination. Patient with grave condition usually immediately hospitalized in emergency aid department, because they are needed constant control of the function of vital organs, and sometimes the activity must be controlled by special apparatus. Middle heaviness patient hospitalized in usual somatic departments, depending main diseases, and patient with satisfactory condition may be treated at home and control of the ambulance doctor. Next step of our examination, assessment of consciousness. Other word, it is science of the functional activity central nervous system and obligatory use for assessment of general condition. Criteria of consciousness condition are the following features: orientation to the surroundings, adequate answers, concentrated attention, and reflexes. Other words, to assess consciousness, we must talk with patient and pay attention how often and correctly patient will answer on our question, and I pay your attention. We must ask the patient about questions which answer you know without him, because you must check answer is correct or not correct. Your main mistake on exam, you will answer what is your name. It's incorrect question because doctor unknown name of the patient with primary interest in hospital. And depending on these criteria, we distinguish two main types of consciousness, clear and deranged. We are talking about clear consciousness if the patient will answer on our questions fastly and correctly. If any disorders, patient will answer later. His answer not completely correct, sometimes incorrect. We are talking about deranged consciousness, which appears due to different pathology, but first of all, consciousness disorder due to disordered cerebral or cardiac circulation, because brain is very sensitive to hypoxia. And you understand, transport of oxygen tightly correlated with adequate blood flow. Some intoxication, endo or exogenic, due to infectious affection, due to some metabolic abnormalities, and through pathology of the brain trauma, new growth, and any other pathology, on which we'll continuously talk during our course. I said you, if the patient answers on our questions later and non-adequately, we are talking about deranged consciousness, which divided on two groups, excited or depressed. Depressed consciousness divided on some degrees depending Glasgow scale. During talking with patient, we'll pay attention on opening his eyes to pain or sound, motor and verbal response to stimuli. For example, cloudiness is initial stage of deranged consciousness, when the patient will answer on your questions later, but his answer will be correct. More heavy stupor. Patient will answer on your questions later and his answers incorrect. For example, you will answer him what is day today. He will answer later and can name any day of the week, which not correlated with presented situation. More heavy stupor, when the patient sleep and can respond on your questions only after intensive stimuli. You can shake him, you can repeat your questions loudly. Patient can open eyes, but his answer will be incorrect and very, very short. He can answer yes, No. Can say any words which not correlated with situation. And more significant depressed consciousness is coma, when the patient doesn't respond on your questions and any stimuli. You can shake him, you can touch him, you can repeat your questions loudly. No answer from the patient. It is coma. I'll again pay your attention. To assess consciousness of patient will obligatory talk with him, and depending his answer will distinguish clear or deranged consciousness. Deranged consciousness divided on some characteristic from cloudness to coma. Coma may be a result of severe vascular or other problems. And depending on diseases, we distinguish alcoholic coma due to intoxication with alcohol, apoplectic due to hemorrhagic affection of the brain, diabetic, hepatic, uremic due to intoxication with some substances, which detoxification disturbed due to affection of liver and kidney, or severe metabolic disorders patient with diabetes mellitus, for example. Excitation of the central nervous system manifested with some irritative disorders, such as hallucination or delirium. When the patient non-adequately excited, his behavior not corresponded of definite situation. We are talking about delirium when the patient see subjects which are absent in surrounding. More often, these disorders characteristic for the patient with alcoholism may be due to some psychic disorders or in progressive pathology of vital organs. And we distinguish other mental disorders such as depression and apathy. Patient can adequately answer on your questions, but his behavior not completely correlated with definite situation. This problem characteristic for the patient with heavy long-standing diseases. When the patient lose wishes to healthy, and doctors see that mental activity of the patient depressed. He lost his interest to surrounding, to himself. He can sleep long time. He forgot to wash face in morning. He forgot to eat. He can sleep with clothes and shoes because he loses interest to himself and surrounding. Usually it is caused by long-standing heavy diseases. It may be tumor, it may be tuberculosis, it may be any other chronic diseases accompanied with intoxication, and sometimes needed helpness of the special psychic doctor. You see 3 patients, and depending on the inspection, we can assess this patient in stupor, this patient sober because sleep but can respond on some stimuli, and patient with coma. Next step of our inspection is assessment of posture of the patient or his position in bed. And I'll pay attention, it depends from the ability of the patient to independent movements, posture of the patient or his position in bed depends from ability of the patient to independent movement. We distinguished active posture when the patient independently can do any movement. Passive opposite situation when the patient unable to change his position independently. Usually there are patients in comatose stage, patient after anesthesia, or patient with significant loss of weight due to long-standing diseases. Specific forced posture which is made due to action of some diseases, and sometimes patients don't understand why he takes some or other position, but he knows that this posture helps him to release some pathological symptoms. For example, patient with attacks of bronchial asthma immediately sit and press his hand on any stand, on knee, on bed, on table. This position is called orthopnea and helps the patient in his difficult breathing. Next step of our inspection is assessment of habitus or body build, which depends from constitution, height, and weight of patient. And if all these indices are correct, we are talking about correct body structure. If any deviation, we are talking about irregular body build. Let's stop on every characteristic. Constitution depends from correlation between size of the head, neck, and trunk. We'll compare size of the chest and abdomen and length of extremities. There are main indices on which oriented doctor to assess constitution of patient. We distinguish three types of constitution: nomothenic, athenic, and hypothenic. We are talking about nomothenic constitution when the body is proportional. Patient has moderate size of the head, neck, size of the chest and abdomen approximately same, and moderate length of extremities. 80% of people has nomothenic constitution, and sometimes when we walk along the street we not pay attention on this patient because they are usual. We are talking about athenic constitution when the longitudinal size prevalented over transverse. Otherwise, patient has small head, long and thin neck and extremities, and his chest prevalented over the abdomen. Hypothenic constitution. Opposite correlation, transverse size prevalented over longitudinal. As a result, patient has high head, short and thick neck, short and thick extremities, and his chest shorter than abdomen. Abdomen is prevalented over the chest. I'll pay your attention. Constitution not connects from the height of the patient. You see patient with same height, but one was assessed as nomothenic, other as athenic and hypothenic constitution. If you remember, I said you that every action of doctor has definite aim. And if we assess constitution, why is it needed? Because some diseases tightly correlated with constitution. For example, patient with athenic constitution predilected to the lung diseases such as pneumonia, tuberculosis, to anemia. Patient with hypothenic constitution predilected to some metabolic disorders, diabetes mellitus, ischemic heart diseases, essential hypertension. And this knowledge helps the doctor in prophylactic work. especially in pediatric practice, because we must start our prophylactic measures from the beginning, not from adult patient. And if you see patient with some or other constitution, we can give some recommendation to prevent development and progression of some diseases. Height. Our height regulated by the glands of endocrine system, and first of all pituitary, thyroid gland and sex gland. As a result, we distinguish normal height for the males and females, which slightly less. If the height less than 150 centimeters, we are talking about dwarfishness, which appears due to hyperfunction of the inferior lobe of the pituitary and is called as nanism, because patient delayed only in physical development, but his mental activity completely halt. More grave if the dwarfishness is caused by hyperfunction of the thyroid gland. In this case, we are talking about cretinism, which is characterized with delay both physical and psychic development. Opposite situation, height more than 2 meters, we are talking about gigantism, which is caused by dysfunction of the anterior lobe of the pituitary. Next slide demonstrates you 3 people, one with normal height, with gigantism and with dwarfishness. And then you can compare this patient with hyperfunction of pituitary, nanism, or hyperfunction of thyroid gland, cretinism. Weight of the patient tightly correlated with his height, and we distinguish normal weight, insufficient weight. In grave condition, it will be to cachexia, and increased weight or obesity. Usually, we assess weight with different formula, but more often we'll use indexed body weight, which counted when we divide weight of the patient measured in kilogram on his height in meters in second degree. And normally it's varied from 18.5 to 25. If less, we are talking about insufficient weight. If it's increased, we are talking about obesity. More easy variant when we'll minus 100 from height of the patient. For example, patient with height 180 centimeters can have optimal weight near 80 kilogram, plus minus 20% depending on age. Slightly less in younger period and slightly more in adult period. But more severe variation needed more correct assessment with special formula, which are used for diagnosis of obesity, degree of obesity, and prescription of sign-specific treatment. Next step of our examination, assessment of posture or attitude of patient, which depends from the activity of central and peripheral nervous system, development of muscles, and condition of spine and bones and joints. And if we reveal some deviation from norm, we'll find problem first of all in these systems and organs. Normally, patient has erect posture, he easy gait, his movements are free and unconstrained. To assess posture, you'll understand you must ask your patient walk along the room. Now, usually in doctor's practice, we'll assess posture immediately when the patient enters in our room. On exam, you ask your examined patient to stand and walk along the room. And I said you, if the patient has erect posture, easy gait, his movements are free and unconstrained, your conclusion will be gait is energetic or active, which is correspondent of norm. If any problems, for example, patient difficulty rise his legs from the floor, his gait accompanied with friction movement, slightly shaked. We are talking about different deviation from norm. Gait may be weakened, may be specific posture, which depends from some pathology, strain, infring, proud, and others, which you will gradually study on special courses in neurological department, in traumatological department, and any other courses. Next step is inspection of skin. We'll assess whole skin and formulate conclusion when we finish full examination, because at the beginning of our inspection, we'll assess only exposed skin, but then when we'll examine separate part of the body, we'll plus our result from inspection of the chest, body, and extremities, which can be covered with cloth. During inspection of skin, we'll pay attention on its color, elasticity, humidity. We'll pay attention on some eruptions of the skin and other problems such as hemorrhage, lesions, trophic changes, and growth of external tumor. But I'll pay your attention. In your answer on exam, obligatory must be assessed color, elasticity, and humidity. And then you can finish your answer. No visible pathology. It shows that skin is clear without any pathological element. Now let's stop on all these characteristics. Color or shade of the skin depends from our nationality, and normally we are talking about body color. You can clear if you want, but conclusion body color will be enough. In pathology, skin may be pale, patient with anemia, may have icterose or yellowish color due to pathology of liver, may have some cyanotic hue, patient with hypoxia due to lung or heart dysfunction, may be red color due to increased body temperature or some specific diseases. Gray color is very bad prognosis for the patient, especially in final times of his life. Bronze line due to dysfunction of extrarenal glands, for example. Color of the skin may be changed local size of the body. In this case, we are talking about pigmentation, which may be distinguished on two types, hyperpigmentation or depigmentation, absence of color on definite sides of the body. If you reveal any pathology, will obligatory show its size, location, and intensity. For example, you see hyperpigmentation on the face of patient, which assess as mother's mark or nervous. And opposite, local hypopigmentation, which is characteristic for specific disease, pellagra. Elasticity of the skin depends from the age and tightly correlated with water balance. Normally, our skin is elastic. No any walls which visible on usual distance. Non-elastic skin appears due to deficiency of water in organism. Humidity also tightly correlated with water balance, and normally we are talking about usual humidity which accompanied with elastic skin. In pathology, humidity decreased, we are talking about dry skin, or opposite rise, we are talking about moist skin, when visible drops of the water on skin as patient immediately go out from shower. Moist skin is characteristic for the patient with decreased body temperature, usually in crisis period. Patient with tuberculosis, diffuse toxic goiter, malaria, also characterized with moist skin. Dry skin, wrinkled. Physiologically, each is connected with age of the patient and will be assessed as norm. But if we see a wrinkled, dry skin in younger patient, we must ask him about non-adequate loss of water, which may be after prolonged diarrhea, persistent vomiting, intensive bleeding, and needed our emergency aid. We can see local dryness of the skin, which is called desquamation, which is characteristic for specific skin diseases. And again, I'll pay your attention. If you reveal any local pathology, you will obligatory show its location and express with moderate, intensive, slight, and other characteristics. You see normal elastic skin in newborn, in younger people, and physiological decreased elasticity and humidity. More completely, elasticity of the skin will be assessed during next method examination, palpation, which you will study on practical classes. But in case report, elasticity of the skin will be assessed in the part of the case report as inspection. Any pathological elements on the skin, eruptions or rash on the skin, obligatory assess depending the location and character of some elements. You can see rosella, small red spots on the body, petechias, red dots on the body, erythema, more intensive reddish of the skin. We can reveal purpura, papillas, vesicles, and any other pathological elements which you will study depending increased knowledge of one or other diseases in different departments. Now let's remember, rash on the skin, more often characteristic for some infectious and allergic diseases. And first of all, we'll exclude these groups of diseases, but these elements may be in any other therapeutic pathology on which we will talk on our practical classes and next lectures. Hemorrhages also will be assessed depending on the location, expressiveness, and character. But now I'll pay your attention on two types of hemorrhagic petechias and bruise, which more often appear in some blood and liver diseases. I'll pay your attention first of all on therapeutic pathology, because our course is basic knowledge of first of all therapeutic pathology. You see patients with erythema, which may be allergic diseases. You can see populous patients with some infectious diseases of skin and growth on the body, which may be result of some blood diseases. Lesions of the skin. Lesions of the skin may be result of post-operative or post-traumatic affection, and depending location and size of the scar, we can improve our knowledge about preceded operation. For example, if we see scar in right ilioinguinal region, we'll ask the patient about appendectomy because it's more characteristic location of this pathology. But we can see specific lesions, stria gravidarum, which appears without traumatization of skin. Usually, its cause is weak connective tissue, which intensively dilated with formation-specific lesions of the skin. Stria gravidarum appears some women after pregnancy, characteristic for the patient with obesity, which periodically significantly lost his weight, then again increase, again lost and increase, and he cannot adequately respond on the change of body size. And it may be as complication Yatsenko-Cushing disease, specific endocrine pathology. You see stria gravidarum on lateral sides of abdomen and in armpit and lateral side of the chest. They can have a red, light brown, sometimes white color. It's not result of trauma, it is result problem with connective tissue. Non-adequate distension of skin. Trophic changes of the skin appear due to disordered blood circulation and manifested as specific ulcers or bed sores. You see trophic ulcers of the patient with severe leg edema when the skin dilated and cannot be adequately circulated with blood, with oxygen, with some microelements. As a result, we see trophic disorders and bed sores, about which we talk with you during fourth course, which appear due to non-adequate prolonged pressure on the skin, constriction of the vessels, and disordered blood circulation. External tumors, which may be revealed on skin inspection. We stop on atheromas and angiomas. Atheromas appears due to problem with fat gland of the skin, which close and its content hold under the skin. And angiomas, abnormal dilation of capillaries. It's not great for the patient, but may be treated due to some cosmetic behavior. I'll again come back to plan of our skin inspection because this question will be given on exam and we have some problem with adequate answer. I'll again remember you plan of skin examination. Pay attention on obligatory indices and let's see how must be formulated your answer. You see on the patient, our answer will be formulated. Skin is body color, elastic, usual humidity without pathologic element. Let's see other patient. And our conclusion will be change. Skin is yellowish color, decreased elasticity and humidity without pathological element. We'll train during practical classes and I think your knowledge will be more deep. Subcutaneous fat tissue tightly correlated with patient weight and assessed as moderate in norm. insufficient or increased or excessive in pathology. And the last index which must be assessed on general inspection is lymph nodes. We can assess only peripheral lymph nodes with which very rich our body. And first of all, we'll examine all exposed parts of the body. You see as rich with lymph nodes neck and head, then armpit and subclavicular area, and ilioinguinal area, where subcutaneous tissue is thin and some enlargement of lymph nodes may be easily seen on inspection. But more full and adequate conclusion may be given only after palpation peripheral lymph nodes. One inspection is not enough for full and adequate conclusion. You see visible dilation of the supraclavicular lymph nodes, which has specific name. It is Virchow node, lymph node, which was prescribed by Russian physician, and it is characteristic for the patient with canceromatous process of the stomach or intestine. We finish inspection of the whole body, as it was general inspection, and stop on the inspection of the separate body parts, which must be made with definite order, which you see on this slide. And today I'll stop only superficially on this information, because I'll give you more full information when we'll study some body systems. For example, examination of chest. More completely we will study together with respiratory and cardiovascular system, abdomen, gastrointestinal tract, other digestive system. But on the head, neck and extremities I'll stop today. Head inspection. This question also will be given on exam. First of all, we must assess position of the head, depending on trunk. It must be along median line of the body, which will be assessed as usual, which is corresponded of norm. Unusual position of the head when it's slightly moved to any side, may be due to cervical myocarditis, spondyloarthritis, or stiff neck, complication of abnormal newborn. Then we'll pay attention on shape or configuration of the head. Normally our head has oval or round shape. Obligatory pay attention on proportions, correspondence of facial and cerebral part, which normally must be approximately same. We are talking about proportional head. But if the prevalent is cerebral part, usually it is result hydrocephalus, or opposite small cerebral part, microcephalus. Prevalence of the facial part is acromegaly. Then we'll pay attention on hair covering. Our conclusion will be given depending on sex. We are talking about female or male types. We can see sometimes specific movements of the head, which uncontrolled definite situation. And we distinguish two pathological movements. It's for today. Then every year your knowledge will be improved. Now I want that you remember two specific movements. Muset signs, when the head moves synchronously with pulsation of the arterial pulse or carotid artery, and Parkinsonism, when the movements of the head are uncontrolled and not correlated with any other movement. And will obligatory assess face expression depending definite situation. Each is the order of the head inspection. You see patient with acromegalic face when the facial part significantly prevalented over cerebral. You can assess proportional head, hydrocephalus, microcephalus, and specific triangle cerebral parts, which is characteristic for specific types of anemia. Hair covering, I said you, depends from sex and assessed as male or female type. But in some pathology may be abnormal growth of the hair. It may be excessive, we are talking about hypertrichosis or hirsutism, or opposite deficient growth, which may be diffuse or local. Hirsutism is characteristic for tumor of adrenal or sex gland. Deficient growth may be result of hypofunction of thyroid gland myxedema or patient with progressive liver cirrhosis. Local deficient growth of the hair is called as baldness or alopecia, which may be result of some specific diseases of the skin or some infectious diseases. We'll pay attention on color of hair to reveal some hair pigmentation disorder. You see patient with hirsutism, you see patient with alopecia, local affection of hair growth, and you see problem with hair color. But again, it must be correlated with the age of patient, which may be assessed as physiological or pathological. Face expression, obligatory correlated with definite situation, and if each is corresponding definite situation, may be assessed as usual. In some pathology, we distinguish apathic, suffering, impressed, exhausted, or other some specific face expression, which not correlated with definite situation and indicates about some psychic or other pathology of inner organs. We distinguish some special facial expression. For example, puffy, dermatic face is characteristic for patients with renal diseases, some venous congestion or compression of lymph duct, upper parts of the body, when the liquid holds on the face in subcutaneous fat. Specific Carvizat face is characteristic for patients with heart failure, cardiac insufficiency. Facies hypocratica is characteristic for diffuse peritonitis, sepsis, and usually is formed in final stage of the patient's life. Facies febrilis, patients with high fever, and acromegalic face specific facial expression. We'll stop on other characteristic of facial expression when we'll study some or other pathology. Today I'll give you only superficial oriented information. And I'll again come back to conclusion, which must be formulated after head inspection, because this question very badly answered on exam. You see order of head inspection, then you see head of the patient, and let's formulate conclusion. Formulate for yourself and compare with my true conclusion, on which you must be oriented. Head is usual position, round shape, facial and cerebral parts proportional, hair covering is female type, and usual face expression. I won't stop on inspection of the face, which also may be given as separate questions. First of all, we'll pay attention on its symmetry, and you see patient with symmetric and patient with asymmetric face. Then expression or countenance of the face, about which we said 1 minute ago. Its shape, regular or some specific, sunken, swelled or moon-like, and acromegalic, maybe any other abnormal shape. We can see some asymmetric movements of facial muscle due to cerebral problems or some affection of facial nerves, facial neuritis, for example. And will obligatory inspect eyes, nose, ears, and mouth, after which we can formulate full conclusion. When we'll inspect eyes, again, first of all, we'll pay attention on the symmetry, normally symmetric, pathology asymmetric, which is called squint or strabismus, which may indicate about some pathology of the nerve, endocrine or brain affection. We'll pay attention on width of the eyes. Usually it's moderate, in pathology may be wide due to patient with thyrotoxicosis, or opposite, narrow width in the patient with edema or myxedema. We'll pay attention on eyes shape, normally they usual. They protrude exophthalmos, patients with thyrotoxicosis or retrobulbar tumor. You understand thyrotoxicosis, symmetrical problem, tumor, asymmetric affection. And opposite, enophthalmos, depressed eyes, patient with myxedema. We'll pay attention on tear secretion, usual, invisible, or maybe hypersecretion and hyposecretion, when the eye becomes dry and as a result accompanied with some pathology of eyes. We'll pay attention on sclera, which usually white color and as usual. In pathology it may be yellowish color, icterose, red color, hyperemic, and we can see some hemorrhagic spots. And obligatory pay attention on pupils, which is glass of the central nervous system. Any pathology with brain obligatory manifested with changing size of pupils. You see patient with asymmetric face due to edema of eyes. You see strabismus when the eyes not symmetric. You see exophthalmos or enophthalmos, patient with yellowish color of sclera and hemorrhagic spots. Pupils, I said you, which is glass of the central nervous system. Normally they must be symmetric. Asymmetry of the pupils is called anisocoria. You see one widened, other narrowed. We pay attention on shape and size, and decrease, narrowing of the pupils is called miosis, opposite, widening, mydriasis. Miosis is characteristic for intracranial hemorrhage, some poisoning, growth of tumor, and uremic intoxication. Mydriasis is characteristic for any unconscious patient except uremic coma, poisoning with atropine, and result of cerebral hemorrhage. We'll pay attention on convergent response of the pupils on movements of some subject and the ability to hold pupils on some distance. We'll pay attention on accommodation, response of the pupils on light, and some may be seen some pathological pulsation of pupils. No, more completely, you will stop on this pathology in neurological department, because I said you, eyes is a glass of the first of all condition of central nervous system. During inspection of nose, We'll pay attention on its size, which normally usual, but with maybe enlarged patient with acromegaly, maybe disfigured patient with arenoscleroma. Shape of the nose also may be changed in some pathology. It becomes saddle, for example, after syphilis or in its chronic development. Soft tissue of the nose disfigured in lupus and lepra, sometimes significantly, and some systemic diseases. You see specific affection of the nose, and we can reveal some trophic disorders or hyperpigmentation, which also may be a result of specific diseases or new growth. We'll pay attention on expression of nasolabial folds, which indicates about some pathology. During inspection of the ears, again, we'll start our examination from assessment his shape and size, and color of the skin, which may be locally changed due to some specific pathology. We can reveal some pathological elements, for example, nodules, which is characteristic for some systemic diseases, but full and adequate answer may be given only with special otolaryngology physician, which superficially and deeply examines ears and nose. We can give only superficial characteristic, and our conclusion must be finished obligatory with what's on visible inspection or no visible pathology, because without special instruments we cannot deeply examine these organs and give true conclusion. Inspection of the mouth included in exam questions, and I'll pay your attention on order of mouth inspection. We'll start from the lips. We remember our principles from up to down. Yes. Then we'll examine teeth and gums. Pay attention on oral mucus. Obligatory as the patient opens the mouth. Examine his tongue and tonsils. Examination of lips. First of all, we'll pay attention on shape of the mouth. If it's symmetric, our conclusion will be usual. We can reveal some asymmetry on mouth angle. Mouth may be permanently open without definite needed. We can see some specific deformation, cleft lips, for example, when the mouth connected with nose, which is newborn hereditary pathology. We can see some specific deformation of the lips. Then we'll pay attention on order, usually no any order from the patient. If we feel any specific order, first of all, we pay attention on the oral cavity, because it may be connected with some visible affection or inflammation of the mouth structure. If no problem, first of all, we must examine lung and stomach of the patient, because it's tightly connected with mouth, and all pathological odors will be removed through the mouth. And if no problem, we'll find any intoxication. For example, maybe ammonic odor from the patient with renal insufficiency, acetone odor from the patient with diabetes mellitus, putrid odor due to putrid inflammation or significant disordered digestive process, fetid odor, or any other specific odor. We'll pay attention on color of lips, which normally must be pink. In pathology may be red, bluish, gray, depending on gravity of disease. Sometimes we can see some eruptions on the lips. For example, cold sores. I think sometimes you was sick with such problem. Herpes labialis more often appears in cold season, and specific fissures in the mouth angle, which appear due to some hypovitaminosis due to pathology of the small intestine or any other metabolic disorder. Teeth may be assessed only superficially because full conclusion may be given only stomatological physician. But visually we can assess his color, we can say healthy or not teeth because it's easy visible on superficial inspection. We can see dentures in the mouth. Then we'll assess condition of gums. Pay attention on its color. Can be revealed edema, ulceration, some hemorrhage from the gums which not needed special examination. Oral mucus. First of all, when you ask the patient open the mouth, we'll pay attention on condition of soft and hard palate of the oral cavity. Usually it has pink color and may be assessed as usual oral mucus. It's enough for conclusion. But if you reveal some changing of color, you can show it's local or diffuse. We can reveal some hemorrhagic spot. We can reveal abnormal coating on the mucus, on the near the lips or other parts of the oral cavity. Tonsils also may be examined only superficially, but we can see that its size increase because normally tonsils invisible or slightly visible may be changed its color. We'll pay attention on presence of patch, lacuna, purulent score, which indicates about specific pathology, tonsillitis. And the tongue is gland of digestive system. We'll assess its size, which may be enlarged in patients with some diseases, on which we'll stop later. We'll pay attention on color. Obligatory assess it's moist or dry because dryness of tongue is signs of heavy pathology and hypohydration. We'll pay attention on condition of papillae, which must be slightly visible. In pathology they may be hypertrophied or opposite atrophied. Position of the size to reveal some deviation. And if you reveal clear red and moist tongue, it may be result of peptic ulcer. Crimson red enlarged smooth tongue with atrophied papilla is result of B12 deficiency anemia. Dry tongue with brown coat or growth is characteristic for some infectious diseases or grape poisoning. We can talk about tongue long time. Now we haven't this time, but we'll come back to some pathological characteristic during studying of some diseases, and you will be improve your knowledge all your life if you will work as doctor. You see usual tongue, yet each is done with the hypertrophy of papillae, geographic tongue. Each is opposite condition, smooth, bright red tongue with atrophic papilla. Tongue with coated with white coating, diffuse or locally with brown coating. And you see pathological deviation of the tongue, which indicate some urological disorders. I won't formulate you correct conclusion on mouth inspection because I said you this question will be given on exam and you have some problem with formulation correct answer. Mouth is usual shape without pathological odor. Lips are pink. Teeth, gums, oral mucosa are usual color without visible pathology. Tongue is usual position, size and color, moist and clear. Tonsils without visible pathology. It's enough for correct answer after inspection of the mouth. We'll assess generally other all main elements of oral cavity, but you must obligatory ask the patient open the mouth and assess all elements of the oral cavity. Next part of the body is neck. On inspection of neck, we'll pay attention on two main vessels, carotid artery and jugular vein, to reveal the pulsation or swelling, and thyroid gland, because we can see its visible enlargement. We'll stop on full examination of vessels and thyroid gland when we'll talk about pathology cardiovascular and endocrine organs. And sometimes we can see enlarged lymph nodes. I said your neck is very rich with lymph nodes, which is seen due to the enlargement. Now you must remember, on neck inspection, we'll pay attention on superficial vessels, thyroid gland and peripheral lymph nodes. Inspection of the body will continuously examine chest, abdomen and back of the patient. Pay attention on spinal cord. Inspection of the chest includes information about its shape, type of respiration, some pathological deformities. More completely, we'll stop on this characteristic next lecture when we'll talk about pathology of respiratory system, but now I'll see you only some visible specific deformation. Inspection of the abdomen includes information about its symmetry, size and shape, mobility of the abdominal wall during breathing, about which you forgot on exam, position of navel, which usually depressed, in some pathology may protrude, and some visible peristalsis movements or local affection of abdominal skin or some pathological formation. You will have full information about abdomen inspection when we will talk about pathology of digestive system, and I'll give you full characteristic of every element. Now I'll give you only superficial characteristic. Examination of muscular system includes information about the development. We can reveal local atrophy of the muscles, for example, compare one and other sides of the body, one and other hand. We can reveal some determination of muscular strength and detection of functional muscular disturbances, cramps, which may be seen on superficial examination. Cramps appear due to renal insufficiency. It may be specific signs of some pathology such as eclampsia. It may be result of hepatic insufficiency due to intoxication, meningitis, inflammation of the central nervous system, brain, Tetanus specific diseases, which is characterized with cramp. It may be result of dehydration, patient with cholera. And you remember, depending development of muscular system will depend gait of patient. And if we reveal some problem with gait, we'll pay more full attention on inspection of muscular system. And finish our inspection with inspection of skull, spine, and extremities. Inspection of the spine will pay attention on its physiological deviation. We distinguished 4 physiological deviations, 2 lordosis and 2 kyphosis. But maybe some pathological kyphosis or lordosis or scoliosis, side deformation of the spine, which may be result of specific pathology of the spine or complication on any diseases. For example, maybe complications such pathology as tuberculosis or some specific pathology. You see severe scoliosis, you see scoliosis with kyphosis, and also severe scoliosis. You'll understand its affect activity of the, first of all, chest organs. Lung and heart can change its position and manifest it with some subjective discomfort. Inspection of the extremity includes information about examination of limb, when we can reveal some deformities, problem with muscles, we can reveal tremor of extremities, the edema, local changes of skin as scar, ulcer due to trophic disorders, which I saw you some minutes ago. We'll pay attention on cause of vessels to reveal specific pathology, varicosity of the vein. And you'll understand all these elements can indicate about some or other diseases. Joints examination includes information about the visible changing and assessment ability to movement, because from condition of joints depends our movement activity. We'll pay attention on fingers of patient to reveal specific Hippocratic or drumsticks fingers. We'll pay attention on nails characteristic, because some pathological shape, claw glasses nails characteristic for Hippocratic fingers. We'll pay attention on the color, which can early indicate about hypoxia or some other problem. We can see breakage of the nails, which indicates about some metabolic disorder, deficiency of some vitamins or microelements. Longitudinal and transverse lines on the nail also can indicate about some hypovitaminosis or deficiency of some microelement. But I'll pay your attention. Hippocratic fingers and clock glasses nails indicate about chronic purulent process of the lung, long-standing subacute septic endocarditis, congenital heart defects, and liver cirrhosis, which are also long-standing. It's not characteristic of only one pathology. First of all, each is characteristic for chronic pathology, and pay attention of the doctor on long-standing diseases, because there are specific deformation. You see specific deformation of extremities, like X, the characteristic for syphilis. You see varicosity, dilation of the veins. You see trophic disorder, gangrene. You see some specific changes of nails due to bad care of the patient, which is characteristic for senile patient. You see changing of the peripheral part of the finger, which is drumstick fingers, because its peripheral part specifically widened and enlarged, and changing of nail shape compare normal and glass-like nail. Other words, I'll show you Hippocratic finger, drumstick fingers, which has specific thickness of peripheral part of the finger, which nail also has specific clock or glass-like shape. And again, repeat that Hippocratic finger indicates about long-standing, chronic, maybe purulent cause of diseases. You see specific changing of nail shape, which may be result of progressive anemia. You see breakage of nail with transverse line or longitudinal line, which also indicates about some deficiency of microelements. First of all, it may be iron deficiency, anemia. And I won't finish off our lecture on joints examination, because these questions will be included in exam questions, but you not have special class on joints diseases. During joint examination, first of all, we'll pay attention on its shape to reveal some deformation or dislocation. We'll pay attention on local changing of color due to hyperemia, because increased temperature or any other problem. We'll pay attention on size of the joints to reveal edema. Compare asymmetric due to local edema. Obligatory assess articulation, ability to movement, and we distinguish active when the patient moves with his joints independently, or passive when the doctor moves the joints of the patient. One finger fixed joints which located above exam, other hand moves joint in definite direction depending the characteristic, because every joint can do specific movement. During palpation of the joint, or sometimes during active movements on inspection, we can reveal some crepitation, we can reveal some restriction, active or passive movement, and the tenderness. And we'll assess movement are painful or restricted due to active inflammatory process or other pathology, for example, trauma, or they restricted due to some pathological formation, for example, decreased elasticity and as a result activity of ligamentum, which fix joints in definite position. And our conclusion must be formulated with definite order. No, for example, we'll examine knee joint, and I formulate you conclusion which is characteristic for norm. Knee joint is usual shape without visible pathology. Active and passive movements are full and painless. But I'll again pay your attention for order of examination and formulation correct conclusion, because on inspection will be given very more questions on exam. Every exam task will include questions about inquiry, inspection, palpation, percussion, auscultation, all steps of physical examination. And when you inspect of the patient, not enough only go to the patient, you must give him some direction that your conclusion was accurate. Because every your conclusion you must be ready explain, and will obligatory ask you, why do you think that active movement of the patient full? If you didn't ask the patient moved with her knee or other joint, it shows that your conclusion not objective, because it may be objective only after full examination, which must be visible for the exam teacher. Now will be class on general inspection, and will pay attention on inspection of some part body when you will study some organs and system. And I think at the end of our course you'll improve your knowledge, and we'll finish our course with positive marks. That's all information which I want to give you today. Thank you so much for your attention. Goodbye. Be happy.